Hi everyone, Michelle Giannato here, Vice President Patient Advocate for auto-brewery syndrome information and research. For those of you just tuning in, I was married to a man whose body made alcohol. I was his full-time caretaker. I am here to tell my story as a caretaker and our journey, as well as answer any of your questions. I started getting questions in the group and I just wanted to answer a few of them. So someone actually reached out to me on the phone that knew about my husband's medical condition, but they started watching the videos and because I'm getting into a little bit more detail, he said to me, hey, I have a question for you. I saw your video and I just want to clarify. Your husband got auto-brewery syndrome from one surgery, one simple nasal surgery? And I said, yeah, he did. And it was supposed to be a simple surgery, deviated septum, which it was. I'm not saying the surgery wasn't good, it was great. But he got a post-op infection and had antibiotics, and that's what kicked this all off. Now, I'm not saying but that antibiotics are bad by any stretch of the imagination. They are a necessary evil. They are needed. But for some people, there's a lot of risk factors to developing auto-brewery. You could have gut dysbiosis and a diet high in carbohydrates. There's could be I don't want to say family history because it's really not family history. But for my husband's case, he had some of the risk factors, right? He was someone who ate carbs a lot. He had long-term antibiotic use. He was a type 2 diabetic. And then when he took that antibiotic for the infection for his post-op nose surgery, that seemed to kick everything off. And then each time he was hospitalized, they gave him another antibiotic. So I think that took a bad situation and just made it worse. So the answer to that question is yes, that nasal surgery infection started the whole thing. Yes. Other people in our support group, they have reported that they had foot surgery and they got infected. They took an antibiotic and they developed this overgrowth of yeast and bacteria, the fermenting type, and their body started making alcohol. Another person had an upper respiratory infection, took 2 courses of antibiotics and developed auto-brewery syndrome. Another person, and this also happened to my husband, he took antibiotics for a dental procedure, and following that course of antibiotics, that person developed auto-brewery syndrome. Now, I've taken antibiotics in the past and I have not developed auto-brewery syndrome. Why it happens with one person that gets an infection versus another, I don't know. This is what we're studying. We do have some active studies going on in our nonprofit, and this is what we're trying to understand a little bit more about the body, the good and bad bacteria, the balancing of the good and bad bacteria, the microbiome, the balance of good and bad bacteria in the body is just, it's just starting to emerge as a science that we all need to just understand more about. And I think that there are a lot of medical professionals that are not realizing that there are more people out there whose bodies are making alcohol and they're just not catching it. Because I keep hearing over and over, even this week alone, I've heard at least 3 times, my doctor said he's not going to test me for auto-brewery syndrome because it's very rare and it's unlikely that I have it. That person found a doctor, they were tested, and within 2 hours of eating and drinking carbs, they went from 0 to 0.20. That is 3 times the legal limit. So, I mean, I don't know how to ask the medical community, Please listen to your patients. Please don't dismiss this. It's simplistic in the way it starts, but it's very complicated sometimes to diagnose and to treat. But that's why we're here to help you, and we will give you the tools and whatever knowledge we have up till today. And again, go on our website, auto-brewery.org. There's case studies, download them. Reach out to Barbara Cordell and I. We will help you with what we think is the best testing and diagnosing and treatment. And if we don't have the answers, we have doctors that have over 30 cases and they have the experience to help you. So please reach out to us. And if you think you're a person who might be experiencing what I've described in my prior videos, go out and purchase a Fuel Sensor breath alcohol meter and blow into it hourly after eating carbohydrates. And you should never be positive. Okay, thank you.